So, Dr. Sia, you did the session
Yes.
about self-neglect with Jasmine.
Yeah.
I think that's so fantastic to have an example of that.
Yeah.
What are some, like if people wanting to start combating self-neglect? Actually, maybe before that,
Okay.
I can make a second question.
Yeah, sure.
But first of all, could you explain just a little bit more about self-neglect?
Okay. Yeah. Well, self-neglect is very explanatory by the word itself. It's about neglecting oneself.
Right.
Now, one of the most common misunderstandings about how self-neglect happens for a person is that it's sort of just not really paying attention. But self-neglect is something that is much more harsh than that, actually. It's something within the person preventing any and every effort to even have a look. It might be removing effort itself.
Right. Because it's something that a lot of people are asking about. Like, we've got the example of it, but, really, what is it?
That's right. It's like this really big, overarching umbrella inside a person's mind saying, do not look. Or even, don't you dare have a look. Or you don't deserve to have a look. You don't deserve to notice. So the person might be screaming in pain, screaming in anxious pain, but still nothing is noticed. Right? I mean, if we hook this person up to a bunch of wires, we just see their body screaming, their brain screaming. They might be in a lot of emotional pain, but the person would just not be able to notice that.
Okay, which is a really strong image there that you paint about how it really is so much neglecting. As you say, the person could be screaming in pain, but the self-neglect really prevents them from being able to even pay attention to that pain and take care of it.
Exactly. And as long as it does that, you, the patient, can't get in there and deal with it. Because you can't deal with what you can't see. And this is one of the topics that came up between me and Jasmine as well, that as long as she can't see what's happening, as long as she actually can't see how it works, there's nothing that she can ever do about it.
Right. And there's that moment in the video, where she says, she finally gets to see that and understand that through your help with the interventions that you're using, so she can actually finally start to see. You're right, I understand that. If I don't see something, of course I can't care about it.
Exactly.
Okay.
Exactly.
Fantastic.
Yeah.
And so then, go back to my other question.
Yeah.
What are some ways that some people might be able to, if they're watching and they're starting to think that maybe this is happening, what are some ways to start combating self-neglect?
Okay.
It's far more common than I think people really realize.
Exactly. So one of the first things that you would have to do is to start combating self-neglect by paying attention. Right? If we think about how many therapies there are out there that help a person start paying attention. Cognitive therapy starts helping people pay attention to their thoughts and the thought patterns and the beliefs that underlie those thought patterns. Mindfulness helps a person start paying attention to a series of things like their thoughts and their feelings and any potential judgments that they might have about that. But obviously mindfulness is really big. So it could be about their physiological movements, how their ears notice things, even their taste and gustatory functions and so on and so forth, right? And in ISTDP, this type of therapy that I've been introducing, it's done together with another person. Together we sit and see if we together can start helping you notice things that this pathology, this self-neglect is trying to make you not notice. So I know it sounds a little bit simple, but it's like the way to combat self-neglect is to start noticing. Right,
and then that kind of goes to what Jasmine was saying about, if she could actually start to notice and see.
That's right.
Then we might be able to get to some care.
Right. Exactly. And if we can undermine those authorities in the brain that are saying you're not allowed to look, don't you dare look, you're not worthy of looking, or whatever they might be saying, if we can undermine those authorities, then we can help the person get closer to actually daring to look.
Fantastic. It's excellent. I think it's going to be such an interesting topic for people to look at.
I hope so.
And because I think, again, it's far more common than people really realize.
Yeah, it really is.
Excellent.